This therapy is for women with PCOS, PCOD, endometriosis. Like I have a lot of period pain, a lot of lower back pain, neck pain, and people with a lot of toxic load in their body and a lot more. So in this video, we are going to be talking about cupping as a therapy, and my therapist later in the video will talk in great detail what is cupping, what are the different kinds of cupping, for who is it required, and also explain that how women with these conditions can benefit from a therapy like cupping, and what are the different kinds of cups they use. And they will demonstrate the entire therapy on me since I'm the one who's been getting it done now. Hi guys, I'm Shivani Trehan and welcome to my channel Social Cravings. Now in this video, I'm going to be taking you through one of my physiotherapy sessions, and in this we are going to be concentrating on cupping therapy alone. Now I already have a video in which I had shown other therapies which my therapists were doing on me, which include the myofascial release massages. It includes, I had spoken about how I have a tilted pelvis, and that got corrected through my chiro practitioner. We've spoken about dry needling and a lot of the exercises which they had given to me. Not all those therapies have greatly benefited me, and those therapies are still being done on me. However, the last few months we progressed to cupping as a therapy, and I could see a lot of benefit that I was getting from this therapy, and therefore I wanted to share it with all of you so that all of you could just benefit from it. I will be linking the previous video in case you've not seen it or in case you've missed it. I would definitely recommend that you watch it. I got a lot of feedback from women all across, and they have really benefited from that video, so I would definitely recommend you watch it. So if you're someone who watches my videos regularly, then you already know that I'm someone who has endometriosis, and I have been doing all these therapies from the previous video and now cupping, and I have greatly benefited from them. A lot of my pain levels have drastically reduced, and so they still do some of the previous therapies on me, and I definitely do all the exercises that have been recommended by them religiously. And when I don't do those exercises, I automatically feel that the pain starts to creep in back. My pelvis and my lower back will start paining, or that particular month I might have more pain during my periods. So I definitely highly recommend it for women who have any of these issues and like a lot of period pain. Now when you watch the session, by the end of the session, the therapist also gives some feedback to me basis my current condition. So it seems like I'm still not out of the woods, and you'll hear what feedback they've given to me. So I have to get those tests done now. Now the main purpose with cupping as a therapy is to increase your blood flow, to increase blood circulation, to reduce your pain levels, to reduce inflammation, to boost cell repair, to boost cellular immunity, all of it, which I think is super important for women with all the conditions that I've just mentioned. Now let me make you meet my physiotherapist yet again and take you through one of my current physiotherapy sessions.
Hi guys, I'm Dr. Shivani Trehan. I've been working for past 17 years, not only in just orthopedic and sports field, but more into the women health as well, which can relate to from your PCOS, PCOD to any kind of irregular menstrual cycles, your pain while during your menstruation, or infertility cases. So I've been working towards the holistic part as well, and we have been working with Shivani for over a year now. So we have progressed with the therapies. Last time in the last video, I'm sure you guys must have seen how we were talking about myofascial release, dry needling, chiropractic manipulations. So now over the course of time, we have progressed towards cupping therapy. So we have added the component of cupping therapy in her treatment part as well. So cupping therapy is basically an ancient healing medicine. So it's a Chinese medicine. We can say that its roots are from the China. It's a very effective therapy which promotes body healing basically. So cupping therapy has been widely being used these days and has proven to be effective for the cases of PCOS and PCOD and to take care of the menstrual pain cycle as well. It has many benefits. If I talk right now, I'll just talk about how it is beneficial for the PCOS and PCOD. So it first and primary most is it improves your blood circulation. As a result, your nutritional level goes up to that particular organ which you're treating for. So your nutrition level goes up, so as a result your hormonal system, the entire hormonal system starts functioning in a better way. So PCOS or PCOD, we all know that it's a metabolic disorder as well, so it's all related to the hormones. So once that happens, your hormones start get regulated, or they start functioning in a better way. So what it leads to your lesser pain during menstruation. It helps in better ovulation. And it also helps for weight loss, because this is one of the major issue during your PCOS and PCOD, that women do gain a lot of weight. So it does help for weight loss as well. And along with all these things, it is also said that it is used for those abnormal hair growth that happens in PCOS and PCOD. So it also takes care of that part. So it basically removes your blockages and inflammation that happens at the fallopian tube, at the level of fallopian tubes. So as a result, your cycles, your pain and everything starts improving. PCOS, we all know that, as I said, it is because of the hormonal imbalance. So the cupping therapy helps in your luteal phase of the cycle. So it regulates the hormone during that's the time when it starts regulating the hormone. So it helps in the ovulation. So once your ovulation gets better, that's when it helps for the infertility cases. It does not, one important thing that I would like to tell you, that it does not affect the vital organs. It's a myth. People say that when you do cupping therapy, it's suctioning out. So it doesn't suction out, your tissues or your organs. So your vital organs are safe with cupping therapy. So please don't get scared that what's going to happen, to your organs with the cupping therapy. And generally we do cupping therapy after 2 hours of your meal. So this is one thing that you all should take care of, that once you had your meals, wait for 2 hours before you go for your therapy session. So now we'll just show you the cup set that we use, the cupping set that we use. There are different types of cup set. One is silicone based. The cups are silicone, which is more for the superficial treatment. So it doesn't really work to the deeper levels. Then is your plastic cups, or the glass cups. So again, they are the one that helps to work at the deeper levels. Then you have bamboo cups. So again, the function, the usage is almost the same, but you do have different kind of cupping techniques. Then it comes to your dry cupping. You have different type, like dry cupping, wet cupping, then is a fire cupping. So ultimately, whichever form of cupping we use, the effects will again stay the same. But your therapist has to decide whether you need dry cupping, or you need wet cupping, or you need fire cupping. Fire cupping, generally we help more, it's more helpful when we have to deal with the muscles or the myofascia. The dry cupping, again, it helps at a deeper level, where it helps to improve your blood circulation. Then with the dry cupping, it's decided whether the patient will need wet cupping or no. So the kind of marks that are left after dry cupping will decide whether that area needs wet cupping.
So guys, this is the cupping set that they will be using, and this is the plastic set.
Okay guys, so I'm going to show you how we do the cupping therapy. So this is the cup that we use. These are the plastic cups that we're using here, and this is the gun. So this is a suction gun, basically helps to create a suction. So these are the cups that we keep on the muscle that we need to do the cup, or the fascia where we need to do the cup. And with this, it creates a suction, and can you see, if you can all see this, the skin gets pulled up. So that's where it helps to improve the blood circulation. But when we remove these cups after 5 to 7 minutes, you need to keep this cup for 5 to 7 minutes, and once we remove it, it will definitely leave some mark on the skin, because of which we decide whether we need to go for the wet cupping or we need to stick to the dry cupping only. And but I would like to also mention that there are few contraindications for cupping therapy. We should not have any bleeding disorders, we should not have any circulatory disorders, we should not be having anemia. So really need to have your blood reports ready just to check that your hemoglobin is at a decent range. So anything less than 8 is not acceptable. So we need to be really sure that you're not under that borderline anemic. And the other thing that I would like to tell you is that they do leave marks. So I've been repeating this, that please don't get scared of these marks. These marks take at least your week to 10 days to go away completely. They start lightening up, but you need to wait and have patience for at least like 10 days for them to completely disappear. So don't get scared when you see these dark marks on your skin. They will just disappear. So now I would like to call Dr. Naina over here. She's the one who's been doing cupping with us for a long time. So she would explain you how to do cupping therapy in case of PCOS. What are the areas where one should be doing cupping, and what kind of mark that comes that she would decide if you need hijama or wet cupping or no.
So in case of PCOS, we need to first palpate your muscles, right? So in case of PCOS, we'll do on the abdomen area, this transverse muscle. So first you need to just palpate where the tightness is. So we'll put the little bit of cream. So I feel there is tightness in the transverse muscle. So I'll put 1 cup, like 1 or 2 suction. It's depend on patient. So we'll cover the entire abdominal muscle. So generally we keep it for 5 to 7 minutes, right? And after 5 to 7 minutes, I'll take this off and we'll see what the color of mark is there. Like if there is light pink color, so that means the blood circulation is healthy. But if the color is dark, like purple or maroon, so in case we need to do wet cupping, right? That means there is toxics in your blood. So the next area in case of PCOS will do cupping is your calf muscle. So according to Persian medicine, the wet cupping or the dry cupping on the calf can induce your menstrual cycle, right? So first you will put the cream on your calf muscle, then again you will palpate that where is your tightness, right? Then you will put the cup, like again 1 or 2 suction. We'll cover both gastrocnemius and soleus muscle, which are calf muscles.
I hope you're fine, Shivani.
Yeah, I'm fine.
So it's generally like slightly painful because it stretches your skin. So you do feel some kind of pain and discomfort, but that discomfort goes away within like 30 seconds to 1 minute at the most. So we're going to keep these, Dr. Naina?
We'll keep it for only 5 to 7 minutes. So after the 5 minutes, we'll take out the cups. So as you can see, there is no mark or very less mark. So this indicates lack of blood circulation, or maybe she's anemic, so she doesn't get any mark. So according to marks, one can decide that we have to do hijama or not. Like if you will get pink mark, like light pink mark, then there is no need to do hijama. But if you will get dark purple or maroon mark, then you can go for hijama. Right. So according to Persian medicine, one research article, 60 women in the age of 20 to 40 years, they were done by the wet cupping on the 26th day of their menstrual cycle for at least 12 weeks and twice a week. So they were followed for 12 weeks. After 12 weeks, they examined, like their menstrual cycle gets significantly improved, and also the period cramps or tightening of the muscles gets improved. So in her case, we haven't done hijama for her. So for that, we need to test her hemoglobin, because you can see there is no mark of cupping. So that means maybe she is anemic or there is lack of blood circulation.
Okay guys, so I clearly have to get my hemoglobin checked and my iron levels checked. To be very honest, last year I was anemic and I had to get iron injected in me because my iron levels were almost nil, and that really benefited me. So clearly I have to get it checked. However, again, these therapies have really benefited my pain levels. So I don't have any pain during my non-period days, and even on my period days, my pain has drastically reduced. So initially when my pain levels were very high, I used to go for these therapies like twice a week at least. And now I'm like on a maintenance sort of level. So I go only once a month. But even then, like if my tightness is very high, or I feel that there's not a lot of movement that has happened, or if there's still like some pain when they're doing the pelvic release and everything, then I will I end up taking another session. So that makes it like 2 sessions in a month. So between the previous video and this video, all the therapies combined, or even like if you're getting 1 or 2 therapies, like any one therapy with the exercises that you do, will be very beneficial for your pain levels. And that's it for now, guys. I really hope that this video was very helpful, and if you have any questions, any doubts, just comment below and I will definitely get back to you. And do not forget to like, share and subscribe, and especially share this video with any woman you know who has any of these conditions. I really hope it would be beneficial to them. Lots of love.